We recently found out that Washington Wizards point guard John Wall is going to miss the rest of the 2018-2019 season for surgery to repair something on his foot called a Haglund Deformity. So in this video, we're going to break down exactly what in the world a Haglund Deformity is, and make sure you stick around to the end because I'm going to talk about why getting this surgery could have long-term implications on his overall playing health. What's going on, everybody? My name is Brian and I'm a doctor who's also a huge sports fan, and it's my goal in these videos to combine my two interests and help look at common sports injuries and explain them in a way that's easier for the fan to actually understand and learn from. If you follow the NBA, you've probably seen the news recently about John Wall needing to undergo surgery to repair this deformity in his foot called a Haglund Deformity. So a Haglund Deformity was first described by Patrick Haglund, who was a Swedish orthopedic surgeon back in 1927, and essentially what it is a bone spur, or an outgrowth of bone for lack of a better word, on the backside of the heel bone, right where the Achilles tendon inserts. One of the original descriptions for this condition was actually pump bump, because people who had it would have this characteristic outpouching kind of deformity bump on the back of their heel, and it was often associated with people wearing really tight shoes such as high heels. Now let's take a look at our anatomy to try to get a better sense of what this is, where it is, and why it can have implications on things like Achilles tendinopathy. So here we have our foot and heel model, and if we take a look at some of the key structures here, in the backside we have our Achilles tendon. So the Achilles tendon is the structure that connects the calf muscles, or the gastrocnemius and the soleus, down into the heel bone, or the calcaneus as it's called. The exact area where a Haglund deformity occurs is right here at the very tip of the calcaneus. Lots of different factors go into putting someone at risk of developing this bone spur, so to speak, on the back of the heel. We know that there's some hereditary involvement. We also know that people who have high arches are more prone to getting them. And we also know they happen typically in people younger, between the ages of like 15 and 30. Essentially what is happening is the bone on the heel is responsive to different stresses and from irritation. And so you can imagine, looking back at our model, if there's this big bump out here on the back side of the heel, and the foot's constantly bending back and forth, and that tendon is sliding back and forth, the more that bump is pushing out, the more irritated the bone's going to get, and the bone responds by growing to try to maintain its mechanical properties. As I mentioned, one of the terms for this was pump bump, because it's often associated with people wearing poorly fitting shoes. So imagine if you're wearing a really, really tight shoe, that's just gonna squeeze that spot even more and put even more irritation on the bone and cause it to get even bigger. Now, it's impossible to know exactly why a player like John Wall developed this, if he had it for a long time and it just now started causing problems, or if it was something he started to develop later on in his career. But if you read back, it sounds like he says he's been dealing with pain in the back of his heel for quite some time. So this was probably an issue that's been brewing over time, and just recently kind of came to a point where it was causing potentially long-term problems. There's a couple of other conditions that I want to touch on that can occur in conjunction with this deformity that can often make it an overall confusing picture. So there was a lot of reporting about, is this an Achilles problem? Does he have an Achilles tendinopathy? Is it the bone? And these things can kind of go hand in hand. So the first thing I want to talk about is something called a bursitis. So we have various bursa in our body, and they're basically fluid-filled sacs that help provide lubrication between tendons and bones. So if we look first on our model, and I'll pull up a picture as well, in this space between the Achilles tendon and the calcaneus bone, there's a bursa called the retrocalcaneal bursa. And basically that's providing kind of lubrication, so to speak, between the tendon and the bone. As that bursa gets irritated, sometimes it can cause bursitis, so inflammation, which can cause a lot of pain, a lot of swelling, and kind of contribute to this whole problem. Now, because the Achilles tendon is right there as well, over time you can also get a component of Achilles tendinopathy. So kind of this wear and tear damage to the actual Achilles tendon that can occur with that bony deformity. Now, the two don't have to always go hand in hand. They've done studies looking at players who have an Achilles tendinopathy, and some of them don't have this bone spur, and then people who do have the bone spur don't always develop a tendinopathy. So they're not guaranteed to go hand in hand, but they can occur at the same time, and it sounds like that's what's going on here with John Wall. Now, what do we do to try to manage and treat this? So initially, you just try a lot of conservative stuff. And if you remember the description of how this is putting compression and pressure on the tendon, what you're going to try to do is things to alleviate that pressure. So wearing different shoes is probably the biggest first thing that we'll try to do for patients with this condition. The hope is that over time you lessen that pressure, the inflammation swells down, and things just aren't as painful and irritating. The other thing they'll try doing is putting heel lifts in the shoe, and what this does is it elevates the heel to, in a sense, try to change the angle of the Achilles tendon so that you're not stretching it as much over that bone spur. That's the same reason why people who have really high arches are prone to this, because the way that that arch causes the heel bone to tilt pulls on that Achilles tendon more, putting pressure back on that spot where that bone outgrowth is. Now, the majority of people who have this do really well with just conservative management, and I'm guessing that's what they were trying to do with John Wall for a long time. But the risk you run is that this can be hand in hand with Achilles tendinopathy. And we know that Achilles tendinopathy makes you more susceptible and prone to an Achilles tendon rupture, which is a totally devastating injury. So it seems like from the reports that John Wall has elected to undergo this procedure because he's got some damage in the Achilles tendon, and he's trying to prevent a future injury to his tendon. So it's definitely really reasonable that he's considering this and trying to get it done now, because he doesn't want to put himself in a position where he's got chronic damage to his Achilles tendon that's going to cause problems down the road and potentially lead to a rupture. So hopefully he gets this surgery done and things start feeling much better, and that relieves some of the pressure and tension on his Achilles tendon, which hopefully allows that to heal so that he's not at risk of an Achilles rupture later on in his career. That is it for this video, everybody. Thanks as always for watching. I hope that helped to understand better what exactly a Haglund deformity is and why John Wall is getting surgery to help correct this. And until next time, thanks for watching, and we'll see you later. Bye.